Hey guys, welcome back to Outperform, and today I want to talk to you about a joint by joint approach. And so what I mean by that is if you're into the bodybuilding phase or the bodybuilding world, everybody usually trains by muscle groups. And so a good example would be today we're working chest, shoulders, and tris. And there's absolutely nothing wrong with that when you're trying to build your body specifically. You have to look at a bodybuilder as kind of like a sculptor. They are adding certain parts and they're trying to sculpt their body to look a certain way. Now, as it comes for regular people or for an athlete, we train people more by movements. It could be a hinge movement, it could be a push movement, it could be a pull movement, and so on. So the joint by joint approach is that your body works all together synchronized. And it's important that you understand this concept. The reason why I want to speak about this today is because if your ankle is meant for mobility, then your knee is meant for stability. Your hips are meant for mobility, but your lumbar is meant for stability. And so on and so on. Your thoracic spine area is meant for mobility, your scapula is stability, and your gleno is made for mobility. This is a joint by joint approach. And what's so important about this is because when you get a pain, you can pretty much look for the compensating joint that's next to it that works together as probably a telltale factor of what's wrong. So let me give you a perfect example. A lot of basketball players have high top sneakers due to ankle injuries because of landing and so on. If they start to hurt their ankle, what they do is they begin to tape their ankle for bracing. You see this a lot also in football. Now, does it allow you to keep playing? Yes, it does, and I do understand that. But if you're taping it every day, you're making the situation worse. By taping your ankles, you're not allowing yourself to have any mobility in that joint. That is a direct cause of why you're usually going to have knee pain. You see it in basketball players, you see it in any athletic sport where they have knee pain. They normally don't have a weak knee, they usually have poor ankle mobility. Because the ankle cannot flex, it's being taped, it's being braced, the knee has to take on now the load, causing a patellofemoral syndrome, which is very high in basketball nowadays. So I'm going to show you a simple exercise to test to see if you have poor range of motion in your ankles. So if you're suffering from knee pain, this will be a simple test that you can use to see if you're having poor range of motion, and then what you can also do with the same exercise to actually increase your range of motion in your ankle. So let's take a look. Okay, so here's the exercise. What we're going to do is we're going to pull Damien's shoe about 3 to 4 inches away from the wall. Okay? So we got about that much space, all right? Now what Damien's gonna try to do is he's gonna slowly dorsiflex, push his knee towards the wall, and he's gonna try not to have his heel raise up, okay? So Damien, go ahead and push your knee towards the wall. All right, and go back and forth, back and forth. All right, you don't wanna push forward and hold it for a stretch. You wanna create some mobility. You wanna go back and forth, back and forth. Emphasizing on not picking up your heel. Damien, do you feel any tightness as if like it's hard to keep your heel down?
No.
A little bit, okay? So he's getting a feedback saying that his ankle is still tight. He's got some mobility, but it's tight. If you have any type of tension where your heel is beginning to rise, well, doing this for like say 3 sets of 15 to 20 during your mobility warm-up is perfect. You can do it between every workout. You can do it in between sets to help you. And this will help create some more flexion and some more mobility inside your ankle. Now, here's a trick. Now, we don't want your heel to rise up, okay? But Damien's wearing a tennis shoe, all right? So his heel's naturally risen up. All right, Damien, let's take off your shoe and put your foot flat on the floor. All right, so we can move it back from the wall again. Okay, good. Now let's do it. Boom, look at that. He's got almost a 1-inch lift, all right? The reason why I wanted to show you this is because Damien is an extremely fast runner, but at the same time, his ankles are beginning to get tighter and tighter. if his ankles become tighter, he will not have enough flexion in his foot, which will actually decrease his speed in the long run. A lot of people think it's quad and hamstring, but it goes all the way down. You gotta remember your body works all as one function. So what Damien's gonna do is he's gonna use these as part of his warm-ups or part of his mobility exercises in between his workouts and so on, between his sets. Now, another option you can do is instead of going always forward, you can lean into it and go from side to side. I myself notice I have an issue with one ankle being tighter than the other. I can move to the left better than I can move to the right. That's probably because I broke my leg 2 times training for an MMA fight. One in a fight, I snapped my leg completely in half, and then one time in practice, I broke my fibula. So obviously my range of motion in that leg is still pretty bad off. And my fault for not working on it more and more and more. So this is a simple tip. It's a simple exercise to test to see if you need more range of motion in your ankle, and if you're getting knee pain, it's probably a direct correlation to poor ankle mobility. I hope this helps you out. If you have any other questions, please message me or ask. I can do a video on anything you would like. Also, subscribe to our Facebook page and our YouTube channel, and share this video with anyone you think who may have knee pain or who could benefit from this. Thanks.